Fantastic. Dr. Ahmed Badat, it looks like we've got a whole bunch of people on board so far. I know that I can see some of my patients from Dubai, so that means we're international. We also have some of my local patients. I see some people that I don't know about. So if I can say to everyone, welcome for joining us. I'm going to put a brief about Dr. Badat in the comments section. He asked me to introduce him. My way of introducing him is to say that he is one of the most intellectual doctors that I have ever met. I love Dr. Badat. He speaks from such a powerful place. He speaks from such a great place of physiological understanding. He's not there just to promote medication. He's really there to help people to start thinking about what is in their best interest. I'm letting you know that he might challenge you tonight. I hope he does challenge you. Please, if you want to ask questions, please go ahead and ask in the chat box. Otherwise, Dr. Badat, please, will you tell us why you think that dealing with your health is number one concern for people right now?
Okay, Travis, as you know, I come from an Islamic background. And from an Islamic perspective, health and everything is not compartmentalized as it is in the secular world. And everything has its place and its due importance. Thus, you can't function optimally either in a religious sphere or in terms of your occupation or serving the needs of your family or society, unless your health is at its optimum. And everything is regarded as trust, so is your health. So in order for you to function optimally, you must take significant note of this trust and treat it as such. And you can only do that by empowering yourself with knowledge. How does your body work? What is normal? What is abnormal? What might be something that works for you might not work for somebody else, because everybody is different. Genetics are different. Environment is different. So all these type of things factor in terms of finding a balance which is going to give you your optimum performance.
So, Dr. Badat, let me ask you a question on that. I mean, I'm Christian, you're Muslim. I mean, within the Christian fraternity, there's a lot of unhealthy people. Within the Muslim fraternity, there's a lot of unhealthy people. And yet you start from this point of view that it is part of the trust that you have to look after this body. Why would you say that there are so many unhealthy people, regardless of one's religious background?
As well, there's very few people, whether it be Christianity, Islam, Judaism system, and it reflects in our outlook in life, how we eat. And basically, there is a lack of balance in every sphere of our life. Now, from our perspective, every individual is made up of the mind, the body, and soul. And in order for them to be flourishing, each one has to be balanced in its own right. Most of the time, from a secular perspective, people only pay attention to the body. And Western medicine, allopathic medicine, from which we come from, has tended to compartmentalize everything. I'll just give you a classic example. If a person is diabetic and then he has to go in for a checkup, he goes to an endocrinologist. If the endocrinologist finds something wrong with his kidneys, he sends him to a nephrologist. If the nephrologist tends to find an abnormal heartbeat, he sends him to a cardiologist. So instead of having a holistic approach to a person, we've got this compartmentalized approach, which tends to fragment things. And we can see that in terms of how it affects the person's general health, behavior, outlook. And it's not something that's conducive to healthcare. A person has to have a holistic, balanced approach to healthcare, to life, and to everything related to the body, the mind, and the soul in order to flourish.
So,
and the
Dr.
more
Badat,
we separate ourselves from our roots, yes, sir.
When did this go wrong in terms of medicine, in terms of dealing with health? Where would you say this compartmentalized approach went wrong?
Now you're going to hit a raw nerve, Dr. Travis, because you see, you have to understand our current situation. You have to go back in history. It will tell you that up to about 100 years back, there was a significant competition, should we say, between allopathic practitioners, chiropractors, natural practitioners, homeopaths, and in the subcontinent we have the Hakims, the Ayurvedic practitioners. Up until the big corporations came in terms of sponsoring medical schools, and these are the same corporations that established what we call big pharma to push their agenda. So they give you food that has very little nutrition on one side, which makes you sick, and then they'll sell you the medication on the other side to try and deal with these illnesses. So it's the double, they're making profit out of it twice. Double potential for making profit. So it's a bit of a contentious issue, and if you have to go into it, it's going to take a couple of hours. But since the whole of medicine, allopathic medicine, has become commercialized, things have only gone one way, and that's down.
So let's go into your background so people can understand a little bit about you. I mean, you qualified as a medical doctor. You've done your internship in the Johannesburg Hospital, endocrine, renal, gastroenterology, pulmonology, rheumatological specials, what. Then you did your community service in trauma, accident, and emergency, both in the UK and in South Africa. That's not the stuff that I'm interested in. The thing that I'm interested in is after some time in GP practice, you specialized in molecular medicine, biochemistry, chemical pathology. Tell me how this has influenced your understanding of healthcare as you're discussing with us now.
You would agree, Dr. Travis, that most of our allopathic practitioners are restricted in terms of symptomatic therapy only. Very few, if any, are interested in terms of the root cause of what the patient is presenting with. Whereas those of us from the pathological discipline, and now I know you try to avoid getting into this discussion early, but there's a particular Dr. Chetty from the South Coast that has got a lot of attention overseas because of his successful protocols in terms of treating COVID patients without them even needing hospitalization, oxygenation, or anything of that sort. But he comes from the same background as we do in terms of looking at the root cause of disease. If you understand how the body works, you understand the root causes of disease, and you root it out from its inception, then everything that from there naturally will come to some sort of balance and back disease. So from a pathological perspective, we're interested in terms of the root cause of disease and challenging it from there. Whereas ordinary allopathic medicine just concentrates on symptomatic treatment. For example, a person might have an arrhythmia, so you give him something just to suppress it. They treat the cause of level. And that goes with medicine, and it's across the specialities as well.
So just coming to that, Dr. Badat, when we talk about coming down to root cause, you in clinical practice, let's just confirm for everyone, you are in clinical practice at this point in time. That means you take care of patients on a daily basis.
Yes, my clinical practice is especially with regards to those patients that have been through other specialities and haven't come right. So at the moment, in my private practice, I'm concentrating on stuff like cancer and especially COVID since it's going around. And we've been quite successful in these therapies that we've been instituting.
So how do you come down to understanding someone's root cause?
You see, it comes again, and in the years that we used to teach medical students, one of the most important things we used to tell them is that 80 to 90% of all diagnoses can be made on history. And just by sitting down and speaking to the patient, you get a profile in terms of what the person's functionality is, why did this person present to you, and what is it that's concerning them the most with regards to their health. It might not be the primary problem that you need to address at the moment, but you need to sit down. And for me, generally, the first consultation takes me up to 2 hours.
Dr. Badat, I was going to interrupt
I've
you
got
at
to
that
speak
point.
to this person's individualized program. Yes.
Dr. Badat, I wanted to interrupt you because I was hoping you were going to explain
ahead.
how long your consultation are, because I know that you do an extensive consultation. You take 2 hours to understand a person and their challenges. I mean, that's a far cry from what happens in other medical institutions. But let's not get to that. What do you look for in 2 hours of a consultation?
Okay, you see, the first thing you've got to establish is the reason for encounter. Why did the patient come to me now? They might have been suffering with this ailment for a long time. And what have they done? And I start from everything from the time the patient's eyes open in the morning. What do they do? What do they eat? When do they eat? How do they eat it? What do they drink? What supplements they're taking? What medication are they taking? How are they taking it? Everything from the time their eyes open in the morning to the time the eyes close, and what happens in between the time the eyes close and open up again in the morning. What's the quality of the sleep? What time are they sleeping? Are they feeling refreshed? All those type of things. So in order to treat the patient, you have to have a holistic approach. And in order to treat the patient holistically, you've got to take a comprehensive history of everything that the patient is involved in. Everything from supplements to even when they come and see me, they bring all the results that they have with them, whether it's blood results, X-rays, CT scans, MRI. I go through everything myself because I need to have a profile. Everything is tailor-made to the individual patient. There's no such thing as one size fits all because everybody is different. The genetics are different.
So I can't just go to Dis-Chem and on the shelf at Dis-Chem just start taking some pills off the shelf at Dis-Chem and think that I'm going to be healthy from there, Dr. Badat.
Definitely. I'll give you a classic example. This afternoon, somebody came to see me, a family came to see me, and I think between the spouses, they must have had about almost 20 bottles of supplements on my table. And it's what this one heard is that's good for them, and that other one says that this is good for you, this one will prevent COVID, and that one will do something else.
Dr. Badat, you've gone missing. Are you still there, Dr. Badat? Dr. Badat. Dr. Badat, oh, that is so sad. Dr. Badat, I apologize, everybody, that Dr. Badat seems to be missing. Dr. Badat, if you can hear me, we can't hear you. I'm going to see if I can send him a message. That is so sad. Yeah, he looks like he's left. Hopefully he'll join back in. I apologize to everyone. This is unfortunately the nature of technology. There we go. Dr. Badat, are you back? Dr. Badat, you're on mute, so you're going to have to unmute yourself.
Sorry about that, Travis. I told you prior to the meeting that we've got a bit of a problem with our connectivity here, and it's sort of downgraded from 4G to 3, from 4G to 2G, and that's why it cut me off. Anyway, where did we stop?
Well, I'm going to say that you were talking about the couple that came to see you this afternoon, and they all had different medication from all sorts. Follow on from there.
Okay, you see, the thing is this, everything in each individual is different, from your thumbprints to your fingerprints to your iris. So everything has to be tailor-made to the individual because everybody reacts to different things differently, even if it's something that are beneficial substances, whether it's food, vitamins, minerals, nutrients, supplements, you name it. So everything has to be tailor-made to the individual. Otherwise, you're not going to get where you want to get. I give you a classic example. The person asked me about probiotics. Now, there's no doubt that probiotics are beneficial. But you know what might be a beneficial probiotic to one person might not necessarily be something beneficial to the next person. And how do I find out whether this is the case? So a simple question. I asked them, how long have you been taking this? And they'll give me a time period. And the next question is, did you feel any improvement in your health? If they say yes, I'll say, okay, continue. If they say no, I don't notice any change, then it means that, it hasn't been working for this particular individual and we need to find something else. So everything has to be tailor-made to the individual. And you can only tailor-make something if you have a proper comprehensive profile, hence the initial consultations taking so long.
And certainly one thing that I know from you, Dr. Badat, is when you look at blood tests, and I have certainly sent you blood tests before of patients of mine, and you give me such a detailed understanding. The blood tests that you look at and how you look at blood tests, you're not just looking at the sort of superficial understanding of the markers, you're looking at the interaction. Just give us some detail of how that conversation works for you.
Okay, you see, it comes back to how we used to teach medical students, especially the final years. That's where we teach them how to interpret blood tests and everything, because from a chemical pathology perspective, it is our speciality to assist the clinicians in making diagnoses from the results. And one of the most important things we used to teach the medical students is that you treat the patient, not the numbers. Because sometimes you might see something on a blood result, which you might think is significant, but in the overall scheme of things might not be very important in terms of changing the management of the patient. So it's very important that you remember that statement, treat the patient, not the numbers. I give you a classic example. There's a gentleman I know. His father passed away at an early age because of cardiac arrest. He had a heart attack. And this gentleman's cholesterol is sitting at about 11. And it's been sitting there for about a decade, but he's not taking any medication for it. And I wouldn't give him any medication, whether it's allopathic medicine or herbal medicine or any other medication, because you see, he is physically active and he is looking after the rest of his health very well. So I'm not going to prescribe something just based on one abnormal blood test, because blood tests require some background knowledge into how blood tests work. For example, by definition, 95% of all individuals will fall within the reference ranges that are quoted on blood results. Every blood results usually have a minimum and maximum that they quote on the right-hand side. And by definition, 5% of the normal population will fall outside those parameters. So if it comes up as high, it does not necessarily mean it's abnormal for that patient. That's why you have to have the clinical history and interpret the blood results in that context.
Dr. Badat, let me interrupt you right now. Let me interrupt you right now. So when it comes to making a diagnosis, because I have patients that come to see me, and let me make it clear, I'm a lonely chiropractor. I don't believe it's my job necessarily to make outrageous diagnoses of patients, especially not outside of what happens in terms of spinal issues. But I have patients that come to see me all the time, and they're not only rattling off the medication that they're on, they're rattling off the diagnoses that they have been receiving from different practitioners. How easy is it to make a diagnosis that is wrong? How easy is it to make the diagnosis that's right? Let's come down to that, because I know that on this call, there's going to be people that have been given a diagnosis, and I want them to be able to ask the question of themselves, is this a true diagnosis, or is this a diagnosis, like you're saying, a person has high cholesterol, not exceedingly high, but they have high cholesterol, and now all of a sudden they've got hypercholesteremia, and they put onto a statin of some sort to counteract that. Dive into that, please, sir.
I apologize upfront because I can't keep away from this COVID issue. And I'll give you a classic example of what I experienced firsthand about 2 weeks ago while I was helping out a colleague. And it had to be with regards to people that have taken the vaccination. On that particular day, it came to my attention that a young 19-year-old chap developed chest pain. And before he could get to hospital, he had a myocardial infarction or a heart attack in the ambulance, and he succumbed to it. The only thing that he was problematic in his case was that he took the COVID vaccine about 2 weeks before. He had no other medical history. On the same day, I seen patients myself who had also taken the vaccine and developed cardiac complications. myocarditis and that. Now, with regards to the question of how important it is in terms of the diagnosis, the initial physician, if that person makes a mistake, that label that they put in terms of a diagnosis will carry through sometimes for many years until they find another physician that's willing to challenge the diagnosis. And most of the time, most of my colleagues are not, or should I say, are too busy to think about challenging diagnoses. So they'll carry on with the thing without questioning, is this person really suffering from this illness which has been put as a label around the neck? So the initial physician, if that person is meticulous in terms of their clinical acumen, then you are on the right way to going down the path to getting healthy again. But if the person is not meticulous or is just there, unfortunately, I can't make excuses anymore for many of my colleagues to make a quick buck, then it is made, the corrections are made, and by that time, they might have already developed side effects for the wrong medication that's been prescribed all these years. So it cannot be overemphasized that the initial physician or healthcare practitioner that one consults must be reliable, knowledgeable, and not, should I say, materialistic. The welfare of the patient must be primary in that person's mind and heart. Otherwise, they get labels that stick for sometimes lifelong, and it might be completely inappropriate, which means they're going to get inappropriate medication and all the other things that are associated therewith.
And Dr. Badat, I want to bring you towards integrative medicine. But before we do that, I think what is important, and you kind of touched on it, and I think it's important to dive into it. When we talk about medication that people prescribed, and let's not only talk about allopathic medication, we can even talk about supplementation, we can talk about, herbal remedies, incorrectly prescribed, and also the multiplication of medication that then has drug interactions. You mentioned earlier the sort of segmentation of health. And I see that as a challenge because you go to this practitioner for this problem and this practitioner for that problem, you're getting different medications from all different sorts. And that then is, as you're mentioning, poorly prescribed and or the multiple drug interactions. Talk a little bit about that, please, Dr. Badat.
Okay, to give a classic example of the drug interaction, from a laboratory perspective, there is a well-known rule of thumb that when a patient is prescribed 5 or more medications, you cannot reliably get or assess any blood test because of the interaction of those medications with the way that the assays that are used to do the test. I don't know if that makes sense to you. Every different assay, for example, if you're asking for a glucose test, there's a specific way in the laboratory that we analyze for glucose. If you're taking 5 or more medication, those chemicals from the medication is going to interfere with the test assay, which means the result you get printed on the paper is not reliable. And that rule applies to the blood as well.
And how many people are on more than 5 bits of medication? I mean, this is ridiculous. I know.
I would say there's billions of people. There are billions, literally billions of people.
Which means come to us and ongoing diagnosis. What you're saying to me, Dr. Badat, ongoing diagnosis then is skewed because you're on 5 or more medications.
And you see, the more medications the patients are on, it indicates to me that the treating physician really doesn't know what he's doing. There's no coordination or there's no straight, plan of action in their mind that this is how I'm going to get my patient back to health. So they're just doing symptomatic treatment. For example, I'll give you an example. If they see the cholesterol is up, they're going to give you a statin. If they say, okay, this guy's got some sort of angina, they're going to give you an aspirin or half an aspirin, Ecotrin or cardiodispirin, whatever it is. If they see the blood pressure is up, they're going to give you blood pressure medication. If that person is metabolic syndrome, diabetic, they're going to get diabetic medication. Meanwhile, the side effects of the medication, for example, they usually give thiazide medication for hypertension. That's going to put your uric acid up. And it's going to also aggravate your plasma glucose. So then they'll give you more glucose lowering medication. And then they're going to give you gout medication because the side effect of the hypertensive medicine has put up your uric acid and you're getting gout now. So you get into this big negative circle or cycle that's very hard to break, because you see, most of the time, the patients themselves also are not motivated to take control over their health because of whatever the reason might be. And they find it just easier to take a pill than say, okay, I'm going to cut this thing out, which is harmful to me, to my health, and harmful to my, prognosis and all that type of thing.
Let's move now, Dr. Badat, to integrative medicine. When you say the word integrative medicine, and you've indicated to me, and I've known you, I think I met you early 2011.
Almost 10 years ago.
Yeah. So when I met you, you're already well established into integrative medicine. How would you define integrative medicine, and how do you approach integrative medicine?
Okay, integrative medicine, to put it simply, is basically using that modality which is best for that particular patient presenting in front of you. To give you an example, there's usually extremism. I see there's extremism from either pole. From the allopathic side, they don't see anything good in any other medical system. And also from the natural medicine perspective, they see nothing good in the allopathic medicine. So I say this. I said, look, when it comes to acute medicine, for example, a person has a gunshot wound, stab wound, polytrauma, motor vehicle accident. The people that are going to help you the most there are the allopathic practitioners. There's no doubt about it. When it comes to chronic ailments, allopathic medicine fails. That's where all the other modalities beat them hands down. Whether, for example, you mentioned your back problems, so we refer them to you, or to the acupuncturist, or to those that do wet cupping, or to people that, for example, asthma, they might require some herbal medication, or the Ayurvedic practitioners. So basically, we are open to any modality of therapy from whichever background it comes, provided it is definitely assisting the patient in their condition. So for back pain, I would say straight, look, you need to go to a chiropractor, for example, and the chiropractor is going to be able to help you more than anybody else, because I'm very much against back operations for a whole host of reasons. Then, for example, if a person has, they're getting constant headaches. So instead of giving them pain medication, I'll tell them go for wet cupping regularly, in addition to the other lifestyle modifications. You understand? Lifestyle modification is non-negotiable. You can't fill a sink until you put a plug in to the drain. And if you go expecting to turn the tap full and leave it unplugged, you'll be just wasting your efforts. And that's what people are doing with supplementation and all the other type of medication. Your methodology must be correct. If the methodology is correct, then you'll get the desired outcome. Yes, sir.
Dr. Badat, just to give you information, we're 8 minutes left, and I told you today we'd run out of time quickly. I'll interview you again. It's so much fun. But let's come to this lifestyle modification. What you said to me today, and I think it's just fantastic, is when you're doing a history, you also assess the person's commitment to making personal change. Tell us more about that.
At the end of the day, you are what you eat. And every patient that comes to me, I ask them up front, look, how disciplined are you? If you are willing to be disciplined, then we can go a long way, because I'm not the person that's going to be doing the work. You are going to be doing the work to get your health back. I will just be guiding you along the way and fine-tuning your progress as it is. To give you an example, a gentleman came up from KZN about 3 weeks back, and he, despite having a glucose of 15 that was done on a laboratory assessment in 2017, he's only now recently that they told him that he was diabetic. So he suffered the consequences of about 4 or 5 years of being undiagnosed. So I asked him the same question. I asked him, how willing are you to be disciplined in terms of reversing this diabetes? So he told me, look, yeah, he's going to be committed. And accordingly, I gave him a very, very strict regimen. Everything in terms of his lifestyle, from when he goes to bed, the amount of exercise he's supposed to do, what he's allowed to eat, what is not allowed to eat, how much he's supposed to drink, what water he's supposed to drink, how he's supposed to drink the water. So that if the following week he sends me a message to say, look here, when he got home, his glucose was sitting at 22.4. But 1 week later, the next day, he instituted the changes. 1 week later, at the same time, his sugar was sitting at 7.6 without any medication, just by the lifestyle interventions that he started immediately. So those lifestyle interventions are non-negotiable, but they are again tailor-made to the individual, depending on what their lifestyle is. Because I have to factor in what work they do, how much time do they have available, what is their socio-economic condition in terms of I can't prescribe expensive supplements for people that are just making ends meet. So everything is factored in to give you the
Good.
holistic approach so
Dr.
that we can
Badat,
get them to where they want.
We've got 5.5 minutes left. Let me ask you a very long question, but you got to give me a short answer, okay? Of the major conditions that we're talking about, heart issues, diabetes, stroke, cholesterol, digestive issues, endocrine issues, how many of these things can be reversed?
I would say, until proven otherwise, all of them. Because you'll only know, you'll only know that you have passed the breaking point if you've instituted positive changes and you don't see the desired results as they're supposed to be. You give everybody a chance. You give everybody the benefit of the doubt. Because we've seen people that had, angiograms done and have shown that they have got quite significant stenosis. In other words, the arteries of the heart were quite blocked up. But they never had angioplasty or stents put in. They just instituted certain lifestyle modifications. And within a 3 to 4 month period, it was a complete reversal. I've got a patient that is in complete remission for cancer of the throat. And unfortunately, he took it as a license to start some of his bad habits again. But he's been complete remission for the last 3 years. Again, based on the type of modalities we've been discussing thus far. So the only time you would say you can't reverse it is that if you've given them a significant chance and you've done what you could in the proper methodology, and then you find out that, look, okay, we missed
okay, Dr. Badat,
by so much.
Badat, finish now.
Yes,
Last two questions. You got 4 minutes, okay? What would you like the future of healthcare to look like? Number one question. What would you like the future of healthcare to look like? And how do we move in that direction? I'm just letting you know, when the call ends, it literally dies. I say goodbye to everyone. I say thank you to everyone. Thank you very much for participating on this. Dr. Badat, answer the questions.
Okay, you see, I look at things a bit differently. I see empowerment of the individuals by knowledge and motivation. That's the way I see healthcare to be going forward. Unfortunately, with the current situation, it's the direct opposite because of the fear factor that's been taken root in most people's minds. So a lot of my time gets taken up in terms of asking people to extricate themselves from the news, everything negative, stick to positivity, and then stick to authentic information that's going to empower you to take control of your own health and listen to your body. Simple rule, I'll go with this. If you eat anything, whether you like it or not, whether people say it's healthy or not, and if you find your energy levels go up, you can think clearly, you don't have any indigestion, that agrees with you. If you eat anything, whether people say it's healthy or not, whether you like it or not, and you find that bloating, constipation, diarrhea, you've got a foggy mind, it doesn't agree with you. Listen to your body and go with what your body is telling you. That's the way I see healthcare going forward.
I mean, Dr. Badat, you've just opened up a huge can of worms. I mean, how many people listen to their body? I mean, we should have classes at school that teach people how to listen to their body, how to have a conversation with their body.
Not only their body, their heart as well. But that's a separate topic itself.
Dr. Badat,
Very few
I love
people,
you so much.
yes,
Jazakallah, my friend. Thank you so much for this time.
All the best to you and all the audience as well, Travis. We'll speak again.
Thank you, my friend. God bless everybody. Thank you very much. You will see the messages coming through. I'm going to send you some messages, and everyone that has asked a question, I will send it to Dr. Badat, and then he can then respond to you directly. God bless everyone. Have a good evening.
Thanks, Travis.
Bye now.
Bye-bye.
Bye.